The results of our study about the impact of magnetic resonance on breast cancer surgical treatment. We know that breast conserving surgery has about 10% of recurrency, and maybe this is due to the multifocal and multicentric disease that sometimes is misdiagnosed by mammography and ultrasound. We also know that magnetic resonance has nearly 100% of sensitivity, so why don't use it in breast cancer staging? The aims of our study was to evaluate the accuracy of magnetic resonance for estimating the tumor size versus conventional methods, to evaluate the ability for diagnosing additional foci, and to evaluate the impact in the surgical management of newly diagnosed breast cancer. We made a study about the patients who were operated in our center, and they were also performed on magnetic resonance. When we compare the histological size with the size of the tumor in the three imaging techniques, we can see that magnetic resonance has the most important correlation. That's to say that it was the best imaging technique for assessing the tumor size. When we tried to discover the additional foci, we saw that we had 20 additional foci in 18 patients. That's the 8% of the total population of our study. That's to say that we had additional foci in the 8% of the patients that was not diagnosed by previous imaging techniques. Well, the results about the changes in the surgical treatment are that we had to change the surgical treatment in 32 patients. That's 13% of the total population. We had to change the surgical treatment because we had an additional foci in a total of 11 plus 3 plus 1. These were a total of 15 patients with additional foci, and 16 plus 1, it's 17 patients where we changed the treatment, not for additional foci, but because the resonance diagnosed a wider tumor. That's a total of 15 plus 17 is 32 patients, the 13%. And the change, analyzing with the pathological reports, we discovered that it was beneficial in 9% of the patients. We had also a 7% of beneficial conversion rate to mastectomy. And the conclusions are that magnetic resonance was the best imaging technique for assessing the tumor size, that we diagnosed additional foci in 8% of the patients, and in the contralateral breast in 1%. That we changed it, the surgical management in the 30%, and this was beneficial for the patient in 9%. That's to say that we improved the surgical treatment in one of 11 patients of our study. So that we have incorporated to our protocol of the staging of the breast cancer, and we think that it should be compulsory in the preparative staging of every patient diagnosed of breast cancer. That's all. Thank you.
Okay. So I'm a surgeon. I'm a breast surgeon from Amsterdam. And what I learned from the MRI is you actually, if you plan optimal treatment in the breast of a breast cancer, you can't do without a proper MRI diagnosis. And this study again confirms this notion very nicely. It differs a little bit. In your study, you could count that you need to make 10 MRIs to profit one patient. In our experience, you have to make 5 to 6 MRIs to really change significantly management in one patient. So it's helpful, but it adds the costs, and you have to balance that.